My name is Hani Mansourian, and I'm the co-coordinator of the Alliance for Child Protection in Humanitarian Action. In this webinar, we will be talking about child protection in the context of coronavirus or COVID-19. We will have a very short presentation of the technical note that we have put out recently on this very topic. Once we are done with that, we will be turning to our speakers, Michael Copeland and Rachel Harvey, that I will introduce at that moment, to tell us a little bit about what they're seeing in terms of needs and trends and patterns of child protection issues that are coming up from the field, and tell us a little bit about some of the innovations and solutions that they're seeing happening. And then we will turn to you guys for question and answer. The question and answer is, from our perspective, we hope will not be the typical question and answer, because we would like you guys to also bring in your contributions. So it's not just you asking to answer your questions, but also sometimes you suggesting solutions. There are 3 specific questions that were mentioned in the final email that we sent. Not all of you might have received it because some of you are not on our mailing list. And if you're not on our mailing list, we encourage you to go on the Alliance website and register so that your email is put on our mailing list so we can communicate with you more effectively. So the 3 questions, which I will paste in the chat box. Question number 1 is, what child protection issues are you observing in the context of COVID-19? What are the things that you see in your context or in the context that you're supporting that is coming up that others should be aware of? What innovative ways are you using or are familiar with for protection of children in COVID-19 context? So you may have already seen or started using innovative ways of operating in this very difficult circumstance. What specific guidance you believe is needed to help child protection actors in their work? So this is the 3rd question. So we would like you guys to tell us what you think is missing in terms of guidance tools that will help you protect children better. I will give a little bit of background before I hand over to Sarah. As many of you know, Alliance is the Alliance for Child Protection in Humanitarian Action, is a network of organizations that work on protection of children in humanitarian context. The Alliance provides technical guidance and produces technical material to support the work of child protection practitioners in the field, policymakers, donors, and academics in this area. Just a little bit of background on where this technical note came from. As many of you are aware, in 2014 and 15, there was the Ebola crisis in West Africa, primarily in 3 countries of Sierra Leone, Liberia, and Guinea, where I had the pleasure of serving myself in Sierra Leone and trying to do child protection work, which was, interestingly, in the beginning, extremely difficult. And it really resonates with the situation that we have today, where it took us several months before we were able to put child protection at the center of the response and create partnerships and collaborations with the health sector, who was deemed to be the central player in the response. And a lot of the conversation that we're having today in terms of whether child protection and social welfare is something that should be prioritized sounds very familiar to the conversations we were having during the Ebola crisis, the West Africa Ebola crisis. And in the few months that we missed in having child protection be a central piece of the response, we ended up having a relatively large caseload of children who were separated in that process, who suffered traumatic experiences. Teenage pregnancy increased significantly in that period. Abuse and neglect increased in that period. It feels like we need, as a sector, to not make the same mistake in this pandemic and make sure that we advocate from the beginning that child protection is an equally important element of this response. Of course, the scale will be very different from the scale of the response within health, but deprioritizing child protection will have significant repercussions for children. In 2017, we started a process within the Alliance to develop a guidance note on protection of children during infectious disease outbreaks, because during the Ebola crisis, we realized how little guidance and lessons learned we have around the issue of protection of children in infectious disease outbreaks. As a colleague put it, a lot of what we were able to do during the Ebola crisis went against the grain of the CPMS, the Child Protection Minimum Standard. So all of us were challenged in terms of what can and cannot be done. So we put together that guidance note, bringing lessons learned from Ebola, from MERS, from SARS, from cholera outbreaks in different countries. When COVID-19 happened, we were not as helpless as we were when Ebola happened, because we had already thought about this. But at the same time, it was yet another big challenge and a lot of unknowns attached to it. Therefore, we decided to start working on a technical note, which I hope all of you have seen. It's on our website. The technical note is a living document. We are planning to revise it probably about once a month, at least in the beginning, to make sure that all the learning and all the new information that is coming is reflected in that. It's an interagency product, so several of your organizations worked on it. And there's also being several kind of side guidelines being considered. Some of the key areas, technical areas that are coming up in our interactions with colleagues in the field are issues of alternative care. People are asking questions of how to deal with the issue of alternative care in this context. Children living outside of family care, including children in institutions, children living on the street, children in conflict with the law, including those in detention, protection of the child protection workforce. How do we make sure that our workforce is not put in danger? Capacity building and retraining of the workforce, role of child helplines in the response, and protection of children in armed conflict. I'm aware that a lot of the efforts that has been underway, for example, on demobilization of children, are now being put on hold because they basically physically are not able to ensure the safety of these children. Protection of children in camps and informal settlements is a huge issue and worry for a lot of us. There seems to constantly be this question coming up of whether child protection is something that can be done in this context. And I hope by the end of this webinar, we have an answer, or at least a semblance of an answer to that question. With that, I'm going to hand over to Sarah to walk us through the technical note itself.
Thank you, Hani. I hope by this time all of you have had a chance to look at the brief, but I'm going to just present an overview of it. Basically, the target of the brief were child protection practitioners. And this was done deliberately with the understanding that there were other child protection actors who were developing other resources targeting parents and communities, for example, or that as it developed, we could develop these additional resources as annexes if need be. In terms of where you can find the technical note, we've created a short URL you can use to easily access the technical note. So it's cpie.info/COVID-19 note, in case that you will be sharing this note with others, or you want to find a very simple way of remembering where the note is. It's on our Alliance website. And then related to this technical note, if you scroll down, you'll be able to see that it's connected to an initiative that we have created. So all of the related resources, whether it's information about the webinar or other related webinars or other resources that we're developing related to the technical note, will all be stored together under that initiative on the Alliance website. If you haven't registered, I would highly urge you or recommend you to do so that you can register for future events and also get access to some of the learning resources that are on the site. Some initial stats, and these stats that I'll be providing are only the stats from the Alliance platforms. So we do expect the numbers to be quite significantly higher because the technical note has also been shared on platforms like UNICEF's websites, like the Chenti website, MHPSS, the network for MHPSS. But so far, we've seen that more than 4,000 people have viewed the technical note itself. And then in terms of social media engagement and views, the views were close to 40,000 people and over 1,500 engagements with related material related to the technical note. It's clear to us that even in terms of the number of people who wanted to join this call, that there's a clear gap, a desire to engage in this conversation in terms of how can we best protect children during this time. So in terms of translations, the French, Farsi, Italian, and Chinese translations are done. Today we'll be uploading the Arabic and Spanish and Korean version And then the Portuguese and Swahili translations are under development. For example, the Portuguese and Swahili, these are being done by partners who have expressed interest in ensuring that a translation of the technical note is also available in these languages. So if there's a language that we haven't translated the technical note into yet, and you have the capacity to be able to support that, please do let us know, and we can send you the Word file. So in terms of the structure of the technical note, it's divided into two parts. The first part looks at the child protection risks, first from a socio-ecological perspective in terms of how it impacts the child, then the family, the community, the society at large, especially in terms of looking at the norms within that society. And then we break down the child protection risk according to some of the harms that has been listed within the 2019 edition of the CPMS. And there we look at what are these risks, and then basically the cost, some of that risk, whether it's related to the prevention or response measures of COVID-19 or the actual disease itself. The second part, if you look at it, is divided into two parts, looking at, as child protection actors, how can we work across sectors and with governments? And so there's a breakdown per sector in terms of guidance in terms of how we can better engage with, for example, health actors, education actors. So much of the work will require a multi-sectoral approach. In most contexts, we will also have to engage with government to ensure that issues related to child protection are being considered. And then the second part of the response part of the technical note looks at what are the child protection specific programs that we can do. And then there's a short table at the end in terms of resources. So basically, in terms of the key messages of the technical note, we're highlighting that COVID-19 disrupts the environment in which children grow and develop, and that there is negative consequences for children's well-being, development, protection. What's needed is that we need to advocate with governments, we need to collaborate with other sectors, and that there are specific child protection programs that we can engage in to ensure that children are protected during this time. In addition to mitigating risks that have been identified in part 1 of the technical note, we need to look at how to strengthen the protective mechanisms. So these are the positive coping mechanisms that already exist within communities, families, caregivers, and children. I won't go into detail in terms of listing the possible annexes that are in discussion. I think Hani has already highlighted those. I just want to point out in the last slide is that, as Hani has mentioned, this is a living document. So currently what's being shared is only version 1. And we do expect this technical note to be updated as required. And that we would highly appreciate if you would send your feedback to cpi.info/COVID-19 note-feedback on the kind of changes that you are seeing that you recommend for future editions of the technical note to include. So in brief, that's an overview of the technical note, and we hope that was helpful.
Great. Thank you very much for this informative presentation. I would like to now hand over to Michael Copeland. Michael has been working in child protection for more than 20 years, and for the last 3 years has held the position of the global coordinator with the child protection area of responsibility, which is based out of UNICEF in Geneva. Over to you, Michael, please.
Thanks. Thanks, Hani. Thanks, Sarah, and thanks everyone for taking the time. I think the fact that we've got 500 and could have had 500 more is a really good sign that people are recognizing the criticality that child protection is central to the planning and the response around COVID-19. So a big thank you. I'll try and not repeat some of the items that have already been mentioned, but perhaps give a few examples that we're already seeing. So I'm with the child protection area of responsibility, and we're supporting coordination groups, and those coordination groups are in humanitarian settings. But a number of things I'm saying today I think are applicable for a broad range of settings. The first thing is just to note how much that context matters when we're reflecting on what are the current issues and what might be the child protection issues coming up in relation to COVID-19. Because we're seeing COVID-19 arriving and being overlaid on very different contexts, with the pandemic exploiting those existing vulnerabilities. For example, we might have strong national systems, including health systems, that can put in place really robust health responses with facility-based quarantine, testing, and so on. And then, as many of you know, We'll have settings where that's not possible, where the health infrastructure and other government services are not able to mount a response or a coherent response. Displacement, conflict, people living in camps and settlements that has been mentioned. So in all of this, we need to think about also, I think, the role that COVID-19 is playing in terms of political analysis and the potential that conflict itself may be exacerbated, or indeed if there are opportunities for that to be eased. So a few thoughts on what we're seeing, and I say this presenting the following material on the basis of our field support team, who are all over the world and are frequently deployed all over the world. Many of them have had to move recently, but from feedback from coordinators as well, and as well as through our help desks who operate in French, Arabic, and Spanish and English. So some of the issues that are coming up. The first is planning around the nature of the response and the health response, and whether that's quarantine centres, facility-based, home-based, and otherwise. And we heard mention around some of the risks around separation. So more generally on alternative care and the different dimensions around alternative care, children who are currently in institutions, and that applies to some regions more than others in the world. And the precautions if children are staying in those institutions where we see a reduction in staff numbers, and the safety for those children, risk mitigation, the need for child safeguarding. Religious institutions holding very large numbers of children in boarding school-like settings where children are there year-round. So we've seen in some countries up to 160,000 children may be housed and more in such settings, and plans for those children to come out of the settings. Children with vulnerable caregivers, so not just those that are elderly, but those with underlying health illnesses, disabilities, and so on, are a particular concern. So children who've already been placed with those children, or children who are in the process of being placed with those caregivers, what happens, or what can we do in terms of planning for the weeks ahead. We see risks increasing already, reported in a number of countries. With that reduction in services and likely less monitoring and protection monitoring, the likelihood of sexual assault, rape, violence increasing. We're already seeing that. Also within that, we're seeing a reduction in services where children may have been able to access vital services, psychosocial support services, as a means and a lifeline to contact others, being reduced. We're seeing lots of questions about psychosocial support, of course, and how to adapt programming, mental health and psychosocial support in the context of social distancing. How do we have group activities, for example, with distance? How do we have remote modalities using technology, for example? Communicating to children, not just clear and accurate information, and communicating in the right way based on their age and development, but also the potential that we need to communicate difficult news to children around the loss of loved ones. Other sectors where we're seeing lots of questions around camp management and camp coordination for those children and families, caregivers living in camps and settlements, health, obviously, WASH, obviously, and education as well. And I'll talk a little bit about some of the innovations that we're seeing. Preparedness, so how are we making sure that child protection is central to preparedness, which may or may not be, depending on the context, central to government's action. Duty of care to staff. So Hani mentioned, how do we keep staff safe? How do we keep staff well-being in mind? Staff who need to shift, relocate, change their working arrangements, look after others, take on additional load, so their well-being, including national staff. Program continuity overall, including issues, for example, around case management. Reprioritizing what are the most critical cases, if that's possible. Thinking about case management where personal contact is critical at this time. How can we do that safely? So we're seeing examples of adapted programming for case management as an example. Some of the things that I would say are needed at this time in terms of an overall approach. One is coordination. It's great that everyone's on the call today and we're all hearing the same information and looking at the Alliance technical note. And we'll also speak about other resources. Working with others, sharing materials and coordinating for efficiency and to pull together at this time. Also to make sure that child protection is central to action. That's critical that we're coordinated. Working with other sectors I mentioned, and that involves advocacy as well, and beyond advocacy with other sectors also in terms of humanitarian response, preparedness I mentioned. working with government counterparts at this time, and this involves the parts of government responsible for child protection, and that can be many, but also helping them to link with other parts of government, for example, health and WASH. So mirroring what we should be doing in terms of working with other sectors at this time. Whilst there are differences across the humanitarian development areas, looking at what's common, and as much as possible using materials and adapting those materials. So for example, materials like parenting would be one. Just a couple of thoughts on some innovations, Honey, if that's okay, of things that we're seeing so far. So for example, working directly with WASH colleagues, and not just to provide mainstreaming guidance and checklists, but developing materials together and signing off on those materials together. Embedding animators with WASH colleagues at this time as they reach out to communities and work with communities. Working with Health Cluster, clearly around community sensitization. I mentioned the use of technology and adapted programming around psychosocial support. Working directly with education colleagues around school closure and plans and preparedness on how to take that forward. Working with the food security cluster, recognizing that so many of the risks related to child protection are driven by food insecurity, child marriage, recruitment, child labor, for example, in their plans as well. These are some of the actions, some of the things that we are doing. I mentioned the help desk in different languages, and Sarah also mentioned sharing materials and information. That's critical at this time. One of the things that we're doing is collecting country-level examples of adapted programming. These are incredibly valuable because they represent an application of global guidance and tools. So collecting those, and given that we have so many materials available, also identifying what are those top kind of key resources for broader translation. Sarah mentioned translation, and we're seeing that's going to be needed in many, many contexts because we have so many materials, looking at that top package of materials. We're also seeing distribution of self-care materials and messages to staff and organizations who are working with national colleagues as well. Looking at humanitarian response plans and new response plans, including advocacy around funding, so working with coordination groups at this time to make sure that child protection is properly positioned in those response plans and funding asks. Overall protection monitoring, given all of the protection risks at this time, so working with colleagues in the protection cluster to scale up protection monitoring at this time. I'd ask colleagues to share some of the links where those local materials can be shared, but also where people can reach out and get contact and support from others through the help desk as well.
Great. Thanks, Michael. Very, very interesting. Fortunately, we have Rachel on the line. Rachel Harvey is the Regional Advisor for Child Protection for UNICEF's East Asia and the Pacific Regional Office, known as EAPRO. She has over 18 years of experience in research, advocacy, and programming on child protection, justice for children, and child rights in development and emergency contexts, including Central Asia, Africa, East Asia, Central America, Eastern Europe, and the Caucasus.
Good morning, afternoon, evening from Bangkok. It's a real pleasure to me to talk to you and also have contact from my situation of isolation in Bangkok. And thank you also, Hani, for inviting us to share reflection from the region to date on the needs. I think the technical note really provides great guidance on issues to think about and key issues that we've been really grappling with for the last couple of months in the region. I'm not going to go into depth on those because I think you heard about them. But I wanted to build on some of those key concerns and actions raised based on the experience in the region so far. A situation which really continues to evolve on a daily basis, as I think it does for all of us around the globe at the moment. And things are evolving all the time. At the moment, it seems that while children can be directly impacted by COVID-19, the biggest concerns that we really have in child protection are secondary impacts. And I just wanted to flag that the region is planning to undertake a study on these secondary impacts in order to inform the short, medium and long-term response for COVID-19, specifically assessing the direct and indirect socioeconomic impact of quarantine, of school closure for COVID-19 on children and on households. Just also want to give you a quick overview of the region in East Asia Pacific Every country in the region right now, apart from Laos, Myanmar, have officially recorded cases. Very recently, PNG and Timor-Leste both recorded their first cases. And same as other regions, but we're really seeing, after a kind of a slow increase in cases, we're really seeing a rapid increase now, especially of local transmissions. We're also seeing, with the rapid closure of businesses, the impending closure of borders and increasing restrictions, these are really driving migrant workers back to their homes in the province within countries, but also back across borders. And so we really can expect an increase outside the capitals and a wider spread of COVID-19 here in the region, and that might be similar for a lot of you around the world at the moment. What I also want to emphasize is the trajectory of cases is very fast, and the need to prepare is right now, especially if you work in a country that's not yet been affected or only has a small number of cases. I have to say in the region, and we're not alone in this region, but 4 weeks ago, we were at a very different point. And although there was a sense that planning was needed and governments were looking at planning, really that sense of urgency wasn't the same as we see now. And of course that's changed. Of course rapid measures have been put in place, but a lot of times governments are playing catch up. And also before, we didn't really have resources that have been mobilized to accelerate actions, but these are coming in bit by bit, and that's just really enabling us to do a multi-sectoral response and to really scale up quickly. I think Michael was saying there's a lot of material that's already been prepared. So a plea not to seek out materials before developing them from scratch. There really has been a lot of good materials done. They've been translated in a lot of languages. So reach out, but also share, because I think that this community is so important for sharing those resources to make sure that we're acting as quickly as we can, because we really have to move fast. One of the areas that I'd like to talk about is alternative care. I see that in the guidance, which is great. But there are 3 areas of alternative care that we're looking at in the region. Children in state-run care, but also in non-state residential facilities. Children who are in juvenile detention, and children also who are in immigration detention. One of the things that we saw early on with wash supplies is PPE equipment, with, of course, health facilities and the health sector were prioritized. But we're also seeing that children in these institutions are highly vulnerable if a case comes in, and the need for wash equipment is absolutely critical. So we've been working with our country offices on a supply checklist and with our WASH colleagues to make sure that those institutions both are given supplies as they come in, cleaning equipment, not just to wash hands, but also to clean the institutions as well. And that those workers are equipped with the knowledge that they need, not just the care workers, but those looking after the institution and cleaning it, to understand the spread of this virus as well. And we've been encouraging and working with the offices to undertake a rapid assessment to understand how many institutions there are, the number of children, and what the needs are. So we have this checklist, which we are very happy to share. We've also been looking about online training. Of course, we can't do face-to-face training, but we need to get that training to these institutions, also to social workers, of course, but just focusing on these current institutions at the moment. Not just about the general care of children, but also how to support the mental health of children in the institutions, but also their own mental health as well, because also they're going to be moving in and out of these institutions. One of the things that we found as well is that state residential care institutions are taken into consideration, but not NGO care institutions, instinctively. And we need those institutions to be considered in a couple of ways. One is to get those supplies to them, to recognize that their funding might be down, to recognize that their staff might be disrupted as well, especially in the event of shutdowns and curfews. So one of the things to think about as well is who is considered to be an essential worker or a care worker, and to make sure that those institutional care workers are considered to be part of that workforce. Otherwise, you're going to have extremely tough situations in institutions that don't have the care staff that can work with them as well. Also, what we're seeing in juvenile detention centres and residential care is a stop in all visiting, which of course is understandable to stop the spread, but also obviously has an impact on children and young people. So this is an area that wasn't considered early on, but is certainly being considered now, how we deal with that as well. And of course, in the guidance as well, childcare and alternative care is of course a big concern, especially when you have really rapid school closures before flexi working or before a closure of business has also kicked in. Normally it doesn't happen at the same time. We've done a lot of work on flexi arrangements in the region. Again, happy to share guidance on this, and there's been guidance developed at HQ as well. One of the things that we know, not just from the region, but from others as well, is that grandparents are, of course, a high-risk group, and they tend to be the first port of call for care. But we know that that can be not the best option in a situation like this. And so your normal alternative care options are severely disrupted, both in a situation where you have rapid school closures, but of course where you also have parents and caregivers who suddenly become ill and not able to care for the children. So how we support those families and how we arrange other care is going to be really challenging. And in this region, we have one of the biggest regions with 3-generation households. And this is going to also make it very difficult to control the disease as well. Another area which is in the guidance, of course, is around case management, to continue the support and case management for child protection cases, but also, of course, recognizing the increase of risk of violence and abuse in the household and witnessing violence and abuse in the household, how we continue those child protection services. And it's extremely difficult. So one is to reiterate the need for social workers and community workers to be considered key workers, which has not always been the case instinctively in the region, something we're still advocating for. Also to recognize the vital role that NGOs are playing for very vulnerable groups, such as street children, children living and working on the streets, or desks and hotlines for violence against children, violence against women. And these are inevitably going to get disrupted, and how we work together and work with the government to ensure the continuation of those services. Another lesson learned from China is that, of course, again, PPE equipment went to health workers first. What they found in China, though, was that this impacted the ability of social workers and community workers to go into the community, because there was a perception that these workers should be wearing masks. But also, as they go from house to house, there was a fear of these workers of contracting it themselves and spreading it, and a fear from the community as well. So it's how we manage the supply, or what we are able to provide these frontline workers so they're able to continue really that critical role, both by keeping themselves safe and others safe as well. Some of the things that were used in the absence of equipment was also these online social media platforms such as WeChat in China, which had already been set up for community workers, to give them messaging, to give them some capacity building, so that they understood what the risks were and how to protect themselves as well. The other piece is, again, going back to vulnerable children in need, is a disruption of day-to-day services. So one of the examples is adolescent health services for adolescents with HIV/AIDS, and that these are not necessarily prioritized for continuation, and that this can be, of course, very risky. So again, thinking about what those critical services are, both government delivered and NGO delivered, is going to be absolutely critical as well. Another issue to share is that as stricter security measures come in, these are usually being enforced by security forces, military and the police, and how we work with those bodies and agencies to promote a child-friendly approach, to have referral protocols in place for handling children that may be out without parental care, who are living and working on the streets. Also, possibly, depending on how this evolves, to also consider how WASH is implemented in the police stations as well, if there are a lot of vulnerable people moving through, if they're caught in curfews or strict security measures as well. And this is an area of concern in a couple of countries in this region. And the final issue that I wanted to talk about as well, that I think has been mentioned a bit, is online protection. Obviously, online platforms and social media really provide a social lifeline and an education lifeline for so many children and so many families, but there is risk attached, and there is an increased risk of grooming, of self-generated images, of possibilities of groomers wanting to and facilitating meeting children depending on the restrictions that are in place. And it's something that we need to consider as children and young people spend more time online as well. So I think those are the key additional reflections on top of the guidance that was provided that we've been thinking about and trying to respond to in the region. Thank you very much.
We are going to open up for questions and answers. There are already questions that are coming up, and I actually see something really interesting happening in the chat box. Given that there are almost 500 people, some people are asking a question whether, for example, there's guidance on this particular topic, and other people are responding to it already, which is great. This is exactly part of the objective of a meeting like this, where practitioners can also exchange between themselves and exchange email addresses and guidance and tools. So please continue doing that.
Yeah, I've also noticed a few items in the chat box about where would I share resources, where would I go to, and I think it's really important, Rachel's point, that before jumping in and generating something, look at what's available. Maybe it won't be perfect, you might be able to adapt it, or there may be something already out there. So in the technical note on the last page, in terms of resources, there's a bigger menu of resources that features the technical note that's also being updated. So that's really good to go to and have a look before sort of diving in and creating more tools and material.
Absolutely, that's a great point. And it's just to save you the resources that you will spend on generating tools, just as Michael and Rachel suggested. Check and feel free to write as well to the CPAR, to us at the Alliance, and ask if something is available or not. And if not, we'll be very happy to even be part of the production of tools that you're working on. So a question that I have here is from Roberta. Is there guidance on child protection related to remote web-based schooling for unsupervised conversations between teachers and children, one-to-one teaching lessons, consent to what is shared, and privacy of data?
Just to say yes from education colleagues, and we can make that available most definitely. It's linked with one of the points Rachel was making about, whilst online platforms provide a great range of remote work, including psychosocial support and continuity around schooling, there are also risks. But yes, from education sector and cluster colleagues, there's material available, but also at country level materials on safety and security around online schooling education.
Great.
And maybe just to say as well that there's a school guidance that came out as well on key actions and messages for COVID prevention and control in schools, and that was released, I think, just last week or a week and a half ago. And the other thing just to say as well for child protection colleagues is how we work with education when designing online schooling to build in the messages through actually the schooling platforms as well, not making it entirely separate, but this is a way to reach children and young people with messaging, not just schoolwork at the same time. And this has been done in a few countries as well, and we're working on using those platforms to reach children and young people. Over.
That's a great point in almost finding opportunity at anything that other sectors are doing. I think Michael also spoke to the issue of cross-sectoral work and the importance of it, almost finding opportunities at any turn when any of the sectors are developing programs, and seeing how we can complement that by ensuring that there is an element of protection and addressing psychosocial distress of both families and children. I have a question, and I have Ala who has his hand up. What child safeguarding policy will apply after COVID? Do you want to ask your question as well before I hand over to the respondents?
Yeah, hello. Thanks for the opportunity. I already asked my question in the chat box. If you want to check it, I was asking about is there an SOP was developed for the case management during outbreaks? for the child protection. Some of the colleagues has answered that there is one developed in Iraq and other one from the GBV sector. So I'm going to check on that. But if there is one that on your reach for the child protection, it would be a great opportunity for all of us to follow on it.
In terms of safeguarding and facility-based centres, quarantine-like centres, we are looking at some of the earlier examples from Ebola that may be adaptable. There's some, a lot that will be useful. Some things are different as well. So that's one of the things we're looking at, but also other kinds of centre-based care and what would be generally standard operating procedures, but including child safeguarding. I think for the case management, you mentioned some of the work that's already been done in Iraq.
Yeah, and just to say, we've been working just on the issue of child safeguarding also in institutions, as Michael was saying, that's something that we're accelerating. So hopefully between us, we'll have something quite shortly on that to share, because I think it's an issue of significant concern at the moment.
Yes, hi, this is Laura from Action Against Hunger. So yeah, I was wondering if we have when alternative group PSS with children, I was wondering when children cannot access the internet or they don't have smartphones, how do we ensure social distancing between the PSS worker and the group of children? How can we access children with MHPSS services, but respecting the social distancing?
Two things. So it's something that has come up, and people are looking, one, smaller groups. So as countries move into the phases potentially toward lockdown, but from bigger group gatherings to smaller group gatherings. So the first one is reconfiguring PSS activities from larger to smaller and smaller groups. And then the other one is group activities with more distance and space, but again, incredibly challenging in settlements and camps and so on. But that's something we are looking at and for at the moment as well. So we're all trying to look at those adapted programs and where that's possible. Where there's not internet and children can't access PSS activities over the internet, what would be the alternatives? Radio, is that an option? Working with helplines to adapt rather than having single calls, having group activities, for example. So I think we're also looking for those examples right now.
Yeah, and I think just fair to say in this region where COVID-19 started in force, social media penetration was very high. And so we were able to reach people through social media and other online platforms. But now it's reaching communities that also don't have that access. And so we're also moving towards that as well. We also don't have any answers from this region, but it's something that we're actively looking at, especially as it reaches countries such as PNG and Timor. Over.
And just to say on the Ebola experience, of course, it was, in terms of the epidemiology of the virus, it was a very different ball game. But radio was huge in Sierra Leone, at least that where I was. I think we are all very much focused 6 years later than when Ebola started. We are all so focused on social media that we forget that there are other mechanisms that are more accessible in some of the more remote areas. So I think we should also think about those potential areas.
And maybe just on that, Honey, looking to different contexts where radio and helplines are there, and how we could adapt or leverage those, right, to the needs at the moment very quickly. So I think that's it.
It's about how child protection actors who are used to providing more traditional child protection services face-to-face, how do we help them and retrain so that they can, at least part of them can be shifted to providing those kinds of examples that Michael gave in terms of group activities over phone or one-on-one discussions and sometimes counseling, because it's a specific skill as well. The core skills are the same, but it's not the same. One other thing that I wanted to mention about Ebola and provision of group activities is that, again, because of the epidemiology of the virus, it's risky, but during the Ebola crisis, we managed to make use of a lot of survivors of the disease in providing face-to-face and direct services, because they can't be carriers anymore and they can't get sick themselves. Of course, children themselves can still pass it on to each other and then take it back home, but with precautions, it might be possible.
Yeah, Annie, while you're doing that, it's a really good point you're making around reskilling or adapting, and taking the example of a helpline, which might be around violence and people calling in to report or seek support, or other issues. So also we may see greater levels of violence against children. So it's not that those services shouldn't be there. If anything, they may be scaled up, but how can we also have others being adapted to different sorts of activities?
Maybe just two quick questions. During emergencies, child-friendly spaces need to be closed due to lockdown measures. Do we have any alternative to that?
Yes. My question is basically, what is, since following this COVID outbreak, what is the adequate and most relevant child protection strategy that is very much relevant in this in COVID crisis? Because most of the communities, they are locked up inside their homes. So I see a lot of challenges in terms of every intervention. So what are the most adequate and most relevant strategy which is needful for community? Yeah.
Great, thanks, Ajaz. So we take that question, the question that I just asked about child-friendly spaces, and then I will take a third question from King. If King you can unmute yourself.
Honey, while we're waiting for that, I wanted to also raise a question that's been asked related to how to program in refugee and displacement settings.
Right. Great, thank you. And the last question we take now, King.
How best can we develop a strategy to quarantine the children in our homes?
So maybe quickly on the question about what constitutes a good strategy, and of course it depends where you are. And if we already have humanitarian setting with all of those challenges or not, so that's the first thing. But what we do know is the parts of the strategy need to involve the following, and we've heard about them today. One is that really intensive work with those other sectors that are out in the community doing outreach and shaping the nature of the response, and their water and sanitation, hygiene, but also sectors like camp management, camp coordination, and also education, who may be working to have continuity. So the work with other sectors, I think, is critical. And I think the person asking the question started to mention it, government engagement in that process, critical. And then some of the identifying what are the key secondary risks for your setting. So Rachel mentioned some of the ones that she's seeing in countries in her region. There may be others depending on your context. So trying to identify what they will be. So if you've got children, lots of children in institutions in your context, or lots of unaccompanied separated children, whatever the case may be, I think that's critical for a strategy, trying to identify what will be those super risk. And then the other is two more things: adapted programming. How can you adapt the programming? And then the last one is everything to do with messaging, psychosocial support and parenting, but also I think accurate messaging just about the virus, because what we're seeing is the absence of accurate messaging and fake news is actually creating lots of additional challenges, anxiety, conflict, and so on. So I think some of these would be the key elements toward a strategy. On the question about quarantining children at home, so having children at home, I think it's a question about, and Rachel talked about the nature of households in a particular country or context. Are children typically with elderly caregivers or multi-generation? So one of the things we'd be looking at who they would be placed with in a house, for example, would be one of the practical things I'd be looking at.
I think what Michael said is right. It depends on the context. I also think, just to reiterate the point, that COVID-19 and the impact of it, the secondary impact, is one thing that's affecting children. There are also a lot of vulnerabilities that continue, that started before and are ongoing, that are critical. And so to be able to collectively map that, understand the services that can continue and how children can access them and what the barriers are, and feed that into the advocacy rather than only focusing specifically on COVID-19, its impact, I think, is going to be critical for the well-being of children as well. And of course, the advocacy around social workers and community workers and how they and to what extent they can continue to do their job as key workers. Again, just to reiterate, that's an absolutely critical discussion. The discussion moves really fast in government, and we have to be around the table advocating for it very early on. Otherwise, that opportunity will be lost.
Thanks for reiterating that very, very important point, Rachel. There are a few questions about protecting child protection workers while they're doing their work, and also ensuring that they don't become an agent of infection going around. So we are working currently with the Global Social Service Workforce Alliance and the International Federation of Social Work to develop a particular guidance on that, on protecting our workforce. So hopefully in the next couple of weeks we will have something to share. I think from, I think it's Jose mentioning that in LACRO, in the Latin America region, one of the key concerns is how to reach the most vulnerable in a context where the service providers we normally work with or through, which is governments and NGOs, are progressively closing down their services and staying confined. And remote and online services are very useful and valuable, but not for the most vulnerable. And that's one question. Another question that is coming up is, if community doesn't have facilities for remote learning, is there any option? Then last question I'll pose is, do we have some material already developed, especially on stigma prevention?
So, Jose, it's a really good point. As government services and the typical other service providers linked to government NGOs may not be providing services, what do we do? One of the things is, in terms of looking ahead at the weeks and the months, those local community-based NGOs, and do we have partnerships with them? Who has partnerships with them? I think that's going to become more critical, and the nature of our partnership with those local, national and community-based organizations is critical, but also the preparedness, as Rachel's talking about, national level government, but also subnational, as they're looking at the weeks and months ahead, who would be doing what and who's able to do what feasibly. I think on the remote question, that's come up, Honey, so many times today. I think that's really around, if we have internet, okay, what would be the options? If we don't have internet, then what are the other options? I really think that's probably, as I saw that, I think you mentioned that's come up again. So is there some form of community animation? Is that radios we've talked about? Is that helplines using different platforms? I think definitely that's something that's come through clearly. I don't have more than what we've mentioned before, and some of those emerging examples. Rachel.
Yeah, maybe just to add to that. I mean, I think that an assessment of the agencies who are there and the organisations there, what's absolutely critical and can't stop, and those that we're going to have to accept that it's going to be a hiatus, or if it's going to be more difficult to deliver. But also, I think that what we know from China is that there is a period of really heavy quarantine, precautionary measures, etc., and then it eases up with, China is going to go back to school in a couple of weeks. So however, tough the next couple of months are going to be, or whenever the trajectory of the virus hits the country that you're working in, hopefully, but it seems from the China experience it's a temporary situation, and we come out and children do go back to school. So again, planning what can be a critical support now that can realistically be delivered based on all of the precautions and the risks that are in place, but also recognizing the impact on children and child protection and child well-being that will come in the months all the way up to the end of this year and beyond. That's going to be significant for children because the economic impact of this virus is going to be enormous. The disruption to family life, the breakdown of families, the increase that we have to expect in abuse and exploitation, etc., etc. So also making sure that we are trying to respond right now to critical needs, but also planning for that transition back into day-to-day life, but also the impact that the COVID has had on children and families, and how we work with other sectors such as social protection, but also to work with social welfare to make sure they're ready and can get ready to really support what are going to be very vulnerable at-risk families for many, many months to come.
And maybe, Honey, just to jump in on the question which we didn't answer about stigma. Some of the best material is coming out from ICRC and IFRC. There's other material as well about how to deal with, prevent and combat stigma.
Great, thanks for that. And maybe just one point on the question that Jose mentioned. I think it also goes back, this issue of the most vulnerable children goes back to the question that we have been talking about, which is, can we advocate and argue with governments to make sure that child protection, or at least segments of the work of that child protection services and social welfare services are doing, is deemed as critical work, essential workforce? And the same, then if we manage to convince the governments of that, then the same argument that applies to health workers, why health workers have to still go back to work. Of course, you don't want to send an 85-year-old doctor with preconditions to work in this particular situation, but there's a large body of our workforce that still can, with minimal risk, of course risk is not zero, but if the service is deemed essential, then that argument can be made. I am going to just apologize. I will still read a few other questions, but we are about 7 minutes before the end of the webinar.
I just wanted to mention that we will be going through all of the comments and calling out all the resources and the questions and answers that's been shared and organize it. If you haven't done so already, I would recommend that you do go to the Alliance website and register for this webinar, so that when the recording is uploaded and the resources are added, you'll receive an email and be automatically notified.
So a couple of other questions. One is around children that do not have documents, so the issue of civil registration, which is a very important question in this particular time, both registration of birth, but also deaths and marriages, which can have a lifetime, especially registration of marriages and birth can have lifetime impact on children. So that's one question. Jennifer is flagging the issue of sexual violence perpetrated against children that cannot care at home. And she's suggesting that she didn't see this in the guidance note and it might have been missed. Thank you for flagging that. Another question from Marcello. Is there any video training, maybe short, that could be shared through WhatsApp for those remote caseworkers? Great idea. I mean, the issue of training and capacity building and retraining and reskilling is a huge one that I think we probably need to grapple with. How can we direct donors to support child protection during this time? So I'll leave it at that, and maybe for the last time, and if you also, Michael and Rachel, have any general comments, your closing remarks, please go ahead.
I think maybe a couple of reflections as I'm thinking about these questions is, as with emergencies in general, they're extremely challenging and tough, but they all do also sometimes provide opportunities for advocacy and investment. And in social work is one of those to really demonstrate how critical that workforce is, but also, as people have said, the protection of that workforce, their own health, their own well-being, and also how we support them and the management of their work to ensure that, you know, we're not inadvertently spreading the COVID either, is really important. So a critical kind of balance between getting those services and critical support out to the community, so there's a continuation and the identification and response to cases, while recognizing the need to balance health and well-being as well, and how we do that in a responsible way, through both trying to provide the equipment that they need, but also the knowledge and awareness that they need as well to do their job so that they're safe. And in terms of birth registration and death registration, in this region it hasn't come up yet, but we would expect it to come up, although coverage of birth registration is relatively high in the countries in ASEAN that it's affected so far. But certainly it's an issue around the migrant populations, although some of them have gone back. We'll expect them to be a very, very vulnerable population as this goes forward. But again, an opportunity for advocacy for registration as well. But it hasn't been an issue that's come up yet in the region as well. And then I do know that in some countries in this region, they're starting to develop this online training. So in the spirit, again, of sharing materials when they're ready, we can also make them available as well so that we can start to share. And as Hani said, we adapt to the context that we're in and to the populations that we're trying to get to, the workers we're going to get to. But this should be also coming out fairly soon from the region as well. But I'm sorry, just one more thing as well. We don't have all the answers. I don't think any of us do, because this is something that we haven't seen before on this scale. We can draw a lot of lessons from before, but certainly we're learning all the time. And as this evolves, I think we have to continue to share on platforms like this and communities like this so we can learn from each other. So thanks to Hani and the team for putting this together.
Thanks, Hani. Echoing that, let's coordinate, let's share resources, new and evolving situations. So those platforms around sharing materials and adapting and learning together is critical at this time. For those in humanitarian context, do work with your coordination groups. Where you can, we work with line ministries in government for all contexts. I think it's important at this time to look at those national systems and helping our government colleagues prepare and link with other sectors. We've heard a lot today about adapted modalities, where we have internet, where we don't. So I think that is going to be a key body of learning. We've also heard multiple times around let's prioritize. And I'm seeing in the chat box, there are cases that it's more critical that we have face-to-face time, but we've also heard we need to keep our staff healthy. So thinking about, yes, having staff continuing to provide, but those who are at lower health risks, but also thinking about case prioritization. There was a question around sexual violence, and we know that in humanitarian contexts, children are particularly affected by sexual violence, for example, teenage girls. So working with GBV colleagues is more critical than ever, looking at the prevention and response around sexual violence. I think in terms of donor engagement and the global level, this is also both a critical time and an opportunity that we pull together and put forward the rationale and the reason for child protection to be central in our work, which we're happy to do with all of you, at least in the humanitarian context. Quick note of thanks, much appreciated, and we continue to learn together. Thank you.
I'll just mention 3 quick points. Please go out and advocate for the prioritization of critical child protection services, both in preparedness for those places that the virus hasn't hit yet, and also response, making sure that we don't end up after a year with a lot of really severe cases of abuse and violence and potential death because it was not prioritized. As Rachel said, this is really an evolving situation. Please excuse us if we didn't have answers for all of your questions. We're all learning together. So, which brings me to my 3rd point. Please keep your feedback and suggestions and sharing of knowledge coming to us and all of the global level coordination groups so that we can help others also learn from you. Thank you very much. We're over time. We hope to continue our efforts through webinars in the coming weeks. So there will be opportunities to discuss some of these detailed questions that you have asked in those webinars. Stay healthy and safe, and thank you very much.